Hey, I'm Andrew with 10-Minute Therapy, and in today's video, we're going to start a new series in which we begin to examine the concept and the diagnosis of depression. Now, depression is a pretty broad topic, and as you're going to see in this video today, what we need to do is start by stepping back and defining what actually is depression, this thing that affects so many millions of people every year. So, without further ado, let's go ahead and start the clock. We'll get right to it. So when we start to examine the concept of depression, it may seem somewhat silly to start with defining something that I think so many people feel they have a good grasp on. I think the general public has an understanding that depression involves certain symptoms, loss of interest, loss of appetite, etc., and that often there's been this narrative that depression is in fact a chemical imbalance in the brain. And so starting with a definition may seem like a waste of time, but my hope is that what you'll hear through this video today is that we potentially know far less about depression than we may think we do. In fact, as we open up the concept and the topic of depression, what we find is that it's a tangled web of different symptoms, heart responses, and life experiences. Depression is not so easily defined and categorized, and so today's video, what we want to do is stop and take sort of a 30,000-foot view in examining depression. Think of it like looking out the window of an airplane and getting a lay of the land down below. From that perspective, we can see so many other things that otherwise we might not be able to. And so my hope in this video today is to just open up this topic and give you a better understanding of why the topic of depression is both very broad, but can also be very specific. So let's start with some basic symptoms that we know and the general public tends to know are associated with depression. Now, if there's one word that I tend to tie into depression, it's the word hopelessness. With depression, what we see often, more often than not, is a sense of hopelessness. Hope is such an important part of how our human hearts function that when there is no hope, it's hard to move forward. When hope has been removed through any number of ways, it's hard for an individual to find meaning or purpose or desire or interest. And so hope becomes a catalyst for everyday life for us. But in trying to define what depression is, potentially the most important symptom would be a sense of hopelessness. Now, we see with depression that there are other symptoms that we know to be fairly common: a loss of interest, a loss of appetite, a sense of sort of isolating oneself, withdrawing from activities, a lack of socialization, all the way to then becoming a lack of self-care, even things like hygiene. But again, if we see depression through this lens of hopelessness, we start to understand that when one feels hopeless, it is very difficult for them to find any sort of meaning or value or purpose in pursuing hobbies and interests, in eating, in caring for oneself, cleaning oneself, engaging socially. And so the more that someone falls into this dark pit that we call depression, more often than not, what we see is they begin to disconnect from other people and isolate themselves. They start to lose interest in things that they normally found pleasure and joy in. And eventually they stop even taking care of themselves, taking showers, brushing their teeth, cleaning their clothes, cleaning their bedroom. And this thing that we call depression often has a very cyclical effect. What I mean by that is that the more that someone engages in these isolating behaviors, the less interest they have in ever stepping back into good, healthy habits. And in a later video, we'll examine some ways to combat depression that might be really helpful for you or for a loved one. But for today, we just want to step into the shoes of someone who's experiencing this and recognize that these symptoms are things that we often point to as symptoms of depression. But here's where the topic of depression gets really sticky and really difficult to manage and untangle this web. While we know that these symptoms, loss of interest, loss of socialization, self-isolating behaviors, lack of self-care, hopelessness. We know that these things are associated with depression, but there's a complex question we have to start to answer, and that's this. How do we separate these symptoms that we might say are symptoms of a depression diagnosis? How do we separate those from the heart's response to everyday life? Let me give you an example of what I mean. If you're not familiar, there's something that psychiatrists, psychologists, and therapists use that is known as the DSM. And the DSM stands for Diagnostic and Statistical Manual. Essentially, it is the Bible of psychiatry and psychology. It is an entire book full of diagnoses. It is the world of psychology's best attempt to create a manual that puts together all the different symptoms humans experience that might point to then specific diagnoses of mental and emotional health issues. Now, the first DSM was published around 1952, and it contained just over 100 different diagnoses. And by the time the DSM-4, the fourth edition, rolled around about 1994, there were over 1,000 diagnoses. Now, in creating this DSM, psychiatrists and psychologists attempted to follow what we would say is the medical model. And what I mean by that is, very simply, the medical model follows a certain path. You have certain symptoms, and you take those symptoms to a doctor who says, based on these symptoms, these meet the criteria for this diagnosis. So your symptoms might be things like fever and chills and achiness, and you go to the doctor and he says these symptoms add up to the flu, and so we're going to treat you for the flu. Or you go into the doctor and you say, my symptoms are sore throat and it feels like I'm swallowing glass whenever I try to swallow, and the doctor examines what he sees and the symptoms you're telling him and he says these symptoms add up to the diagnosis of strep throat, and so we're going to treat you for strep throat. And so psychology attempted to follow this model. If you have these symptoms, they equal this diagnosis, and that's what the DSM attempts to do. But as you can see over time, we're taking symptoms of mental and emotional health and compounding them and saying these things equal this diagnosis. In today's video, we're looking at depression. So when someone has a loss of hope, a loss of interest in activities, and they're self-isolating, we say these things equal depression. But this important question that I'm asking you to mull over today in your heart and mind is, how do we separate those things from the heart's response to life experiences? Let me be more specific than that. How do we know that these symptoms equal depression rather than grief? When someone has lost a loved one and they grieve, do they not lose a sense of hope? Do they not feel sad? Do they not sometimes isolate themselves from others as they grieve? Do they not sometimes lose interest in activities and stop eating and taking care of themselves as they work through grief? In fact, if we just examine grief by itself, depression is one of the stages of grief. And so how do we then separate a diagnosis of depression, a mental health disorder, from something that someone experiences naturally in the course of their human life? And not just grief, but what about just a sense of hopelessness that someone might experience when they've lost their job, or when they've gone through a messy divorce, when their spouse has been unfaithful to them? Throughout the course of human life, we see that it's not abnormal for humans to experience these things, and yet we've clinically said that these things equal depression. So how do we separate them? I think this is a really interesting quote I want to share with you. There was a man by the name of Robert Spitzer. He was part of the team that assembled the third edition of the DSM. This would have been back working in the 1980s into the early 90s. He's a psychiatrist, and so he helped assemble all these symptoms into this DSM-3 so that we could diagnose mental health disorders appropriately. But in 2007, in an interview, I believe it was with the BBC, Robert Spitzer said this. He said, the DSM, by operationalizing the definitions of mental disorders while paying little attention to the context in which the symptoms occurred, may have medicalized the normal human experiences of a significant number of people. In other words, one of the lead psychiatrists who helped assemble the DSM later stepped back and said, you know what? By taking normal human experience symptoms, we may have medicalized things that are otherwise normal expressions of the human heart, and may have done so to a large number of people. Maybe this explains why rates of depression and anxiety and other disorders have skyrocketed in the last 25 years. Is it possible that we're overdiagnosing and making clinical what might be a natural response of the human heart? Let me throw one more monkey wrench into our understanding of depression. This comes from a study that was published in July of 2022 from University College in London, and it said this: the study concluded that there is no convincing evidence that depression is caused by serotonin abnormalities, particularly by lower levels or reduced activity of serotonin. Now, if that quote means nothing to you, let me just say this, that for the last 25 to 30 years, we've been under the impression, maybe even farther back to the 80s and 70s, we've been under the impression that depression is a clinical diagnosis, not part of normal human experience, and that it may be caused by this chemical imbalance in the brain, namely serotonin, a chemical in your brain that helps you feel calm, connected, satiated. And so antidepressants are actually meant to not just increase serotonin production in your brain, but help your brain absorb serotonin even better. But suddenly in 2022, we have this study that says, actually, we don't really have any evidence at all that depression is caused by abnormal serotonin activity. And it leaves us with this big tangled web to say, what do we do with this information? We know that these symptoms often point to depression, but how do we separate the human heart's response to life and grief, and purpose and meaning, and all these things that throughout the course of a normal human life one might experience? How do we know when it's that versus something that is more clinical? Have we maybe overdiagnosed and overclinicalized symptoms that humans naturally experience? You can see that we're out of time in today's video, but I hope that I've left you with questions. And you might be thinking, that's frustrating. I want answers, not questions. But the reality is life is all about asking the right questions and to seek to understand with deeper meaning what these questions might lead us to. And at the very least, what I hope is not to leave you with a sense of hopelessness in these questions, but to question, is it possible that we've made clinical what's natural and normal for the human heart to respond in seasons of depression or hopelessness, seasons of grief or loss, seasons of feeling disoriented? Is it possible that these symptoms we call depression could at times be the way my heart is responding to life, and that maybe I need to work through those and not just treat them clinically? My hope is that these questions resonate with you and at least cause you to start to perceive the world not just through the lens of a clinical diagnosis of depression, but through an understanding that within our chests lies a beating heart that responds dynamically to life. In our next few videos, we're going to start to look at more aspects of depression and even what are things we can do to combat depression for ourselves or maybe for a loved one. In the meantime, I hope that today's video is helpful in helping you ask some questions. I look forward to diving back into this topic with you next week. So in the meantime, I'm Andrew with 10 Minute Therapy. God bless.